something.
And with breast cancer, sorry, with breast cancer is the leading cancer amongst women within this country. Around 300 women unfortunately die of breast cancer every year, and it's due to a lack of us females going to get screened. So they said less than 10% of the population go ahead and get screened. So we need to bring a change concerning that. So I encourage you, and you would encourage your loved ones to get your annual screening. Note that men are also at risk of getting breast cancer. It's a percent with breast cancer also at risk. So it's important that you listen to this presentation as well and you do your annual. One of the main risk factors is having a positive family history. So if you have a mother, an aunt, or a had breast cancer, that cancer, especially with men as risk for developing breast cancer, important to focus mostly on females time of the year, men. Once you reach risk for developing breast cancer as well, that's why they encourage screening to start at the age of 40. Prolonged exposure to estrogen, meaning if you start your menstrual cycle at an early age, less than the age of 12, or if you start menopause at a later age, greater than 55, you're at greater risk for developing breast cancer as well. For those who have children at a later age, like in their late 40s, that puts you at breast cancer. And those who have children, that puts you at a risk for developing breast cancer. If you are exposed to radiation, another, and you were treated with radiation therapy, that can be cancer. You can have breast cancer in the breast, and that could be treated. That can also put you at risk for developing breast cancer in the other breast if that happens. Other factors such as smoking, drinking. There are different types of breast cancer on the slide that you see here. I just put this here because you may have had, if you had a relative or so if the cancer is within the ducts, then it'll be called ductal carcinoma. If it's in the lobules, then it'll be called lobule carcinoma in situ. Now, if it has spread beyond the lobules or the ducts into the nearby breast tissue, then it will be called invasive ductal carcinoma or lobule. So when it comes to breast cancer, what exactly do we look for when we look at our breast? What signs should we look for? So you're looking in the mirror, look at your breast, you're going to look to see a change in the size of your breast, any change in the shape of your breast. If one breast appears to be, you want to go get that checked out at your look at the picture of the skin appears red or tender. A lump within the breast, you want to get that evaluated. Sometimes the skin texture can change. Orange, which is the texture of the orange skin. It can look like that, which can be a risk factor for breast cancer. So if you see those certain changes, you should go to your physician. And you should also look at the nipple. You want to squeeze the nipple to see if there's any abnormal discharge. Of course, if you're not pregnant or expecting and you see a milky discharge or bloody discharge that is abnormal, you should go to your doctor and get that evaluated. So with regards to screening for breast cancer, there are three main. Have the self-exam, which we recommend that you do it at least once a month. You have your annual physical exam, which you either go to your health center or your private physician, and then you have the mammogram. So with the self-exam, it basically entails what I just explained as to what you're looking for. Ideally, for those that are still on their having their periods or on your menstrual cycle, you should do this at least a week after your menstrual cycle, because during your cycle, your breast tends to be a bit more tender. So it'd be best to perform this after the cycle. So you'd stand in front of your mirror, look at your breast, and the same signs that I mentioned that you're going to look for, you're going to do that initially on inspection, looking at your breast for these abnormal changes. And then once you observe those changes, you're going to lift your hands up, and you're going to look for those same changes as well. And then you can see the slide here showing it. You're going to use, so if you're looking at your left breast, you're going to extend the left arm. And then you're going to use your opposite hand, ideally the index to the fourth fingers, these three fingers here, the tips of these fingers, and you're going to press on the breast. So depending on the shape and the size of your breast, you can go in a circular motion. You can start from the nipple, going outwards, and ensuring that you extend all the way up to your collarbone and even under the armpit as well, because you have breast tissue underneath there as well. So you can go from the nipple extending outwards, or you can go outwards, extending inwards. And it may be easier even to go vertically, making sure you get every aspect of the breast. You don't want to miss any breast tissue. Or you can go horizontally, compressing the breast for any abnormalities. And once you press the breast, you're going to same signs I said you're going to look for. You're going to feel if you feel any lumps, any abnormal changes in the skin texture, and you're also going to squeeze the nipple as well to see if there's any abnormal discharge from the nipple. And men, you should be doing this as well every month, okay? Another means of screening is doing your annual physical exam. Whether you are sick or not, it's important that you visit your doctor, whether at the health center, for your annual exam. Because even though you're doing your monthly screens, there are some times where you may not feel a lump, but you're at a high risk for developing breast cancer because you have a first-degree relative, whether it's your mother, your aunt, or your sister who have had breast cancer. And so your doctor may recommend that you start screening earlier. Now, with regards to mammogram, they don't recommend that you do it before the age of 40. So your doctor may recommend that you do an ultrasound or even do genetic testing to see what is your risk factor for developing breast cancer, and so that they can take the necessary measures to help in reducing your risk from getting breast cancer. So mammogram, once you go to your doctor and say you feel a lump, and you're over the age of 40, because screening for breast cancer usually begins at the age of 40, your doctor will recommend that you do a mammogram so they can get a better visualize of what's going on in the breast and what is the lump that you're feeling. So a mammogram is pretty much like an X-ray where it takes several images of the breast tissue. So as you can see in the picture, your breast is placed on a platform, and then it is compressed by 2 clamps. And the clamps can rotate the breast in different directions, horizontally and diagonally, to take different angles and pictures of the breast. Yes, it may be uncomfortable, but it's important. It's important that you get this done. For a few seconds of pain is better than not doing the test at all, and then you discovering that you having it at a later stage and pretty much nothing can be done. And also what's important to note about a mammogram, sometimes you may not feel a lump, and a mammogram can pick up a lump that cannot be felt. So that's why it's important to still do a mammogram even though you don't feel a lump and you're over the age of 40. And it's important to note too as well, the Jamaica Cancer Society, I know they work with the University of the West Indies and Cornwall Regional Hospital to assist in providing mammograms at a subsidized cost of about $4,000. So if you can talk to your private physician or at the health center to see if you can get your mammograms done at a cheaper rate versus going privately, it can be more costly. And I know that can deter a lot of people from wanting to go and get their mammograms done. So if you can talk to your physician. Don't just say, oh, it's expensive, and just leave it and not do it. Talk to your physician as to other options that are there in which you can get your mammograms done. So, okay, you did your self-exam or you went to your doctor and they find a lump. What's next? So ideally, what they would like to do is take a biopsy, where pretty much they're removing the lump to test to see whether, one, if it is cancerous, they're testing to see the stage of the cancer, they're testing the grade, and to test to see if it has certain hormones present within the lump. Now, I know many of you heard a person may say, oh, they have stage 1 cancer, stage 2. What is that exactly? Or grade, the different grades of cancer. So what the stage tells is the extent of spread. So stage 1, the breast cancer, the cancer is confined to the breast. Stage 4, it's spread beyond the breast, it's spread into the blood and possibly to other organs as well. So the lower the stage, the better the prognosis. With the grade also determines prognosis as well. The grade tells how quickly the cancer is growing. So that's why it's important when they take the biopsy or take the sample of the lump, they want to test, and this is going to determine exactly how they're going to proceed with treating the cancer. So the next slide that's coming up is just pretty much showing the different stages of the cancer that I just previously explained. Stage 1 is confined to the area where the cancer is, in this case the breast, and stage 2 it can spread to the lymph nodes, to the skin, stage 3 the blood, and stage 4 to other organs as well. And this last slide just pretty much talks about the different types of treatment. Of course, treatment will vary from person to person, and it depends on what is found once they do a biopsy, once the lump has been removed. If they found that the lump has certain hormones, then you would get hormone therapy. Depending on the size of the lump, the physician may decide to do chemotherapy first in helping to reduce the size of the lump, and then they may proceed with surgery and then have radiation afterwards to help kill any additional cancer cells that may be remaining. So that's pretty much it with regards to treatment. That's my references. I just want you to take away from this presentation that breast cancer awareness shouldn't end with the month of October. This should continue each and every month. Self-care is very important for both man and woman, and health is a part of our self-care. So you should take the time, like I said, at least a week after your menstrual cycle. If you're still experiencing your menstrual cycle, men, you can do it any time of the month. Stand in front of the mirror, you examine your breasts, you feel it to see any abnormal changes, and you need to know what is your normal. So that's why you look at your breasts now to make sure that you don't identify anything abnormal with the breast, and if you do, please don't ignore it. Please go to your physician, go to your healthcare center, and have them evaluated. It's best to be proactive than to ignore it, and then by the time you react towards it, it's too late. So I hope you learned from this presentation. I thank each and every one of you for your time. And yeah, if you have questions, yeah. If you have any questions, feel free to ask. I'll try my best in answering. If I don't know, I'll get back to you with the answer as well.
Right, so if you have questions, we will just take the microphone to you and you could ask your question. Anyone with a question?
I see everybody just wanted to brush up on what we probably already are aware of. I trust that we will go out and do what we need to get done. There are quite a number of us here that are over the age of 40, and we need to start going to get our mammograms done. Apart from that, some of us have our different size boobs, and it can be quite irritating because you feel flustered. So I know I feel flustered sometimes because I'm like, what am I feeling for? But you still have to try. try and do it, although it feel awkward, but it's a habit that we need to develop. We want to thank Dr. Mills. Thank you so much for the presentation. She does have a busy schedule, so we are appreciative of what she has prepared and presented to us today. You have a question?
Or should I repeat it? Okay, in your capacity, is there anything that you would suggest that we do in terms of lifestyle changes that would reduce our risk of getting cancer?
Yes, one of the risk factors I mentioned is obesity. So you can try to reduce the amount, monitor what you eat in terms of having more vegetables, more fruits. Try to reduce the amount of fatty foods that you eat, the amount of fried foods that you eat. Smoking can also increase your risk. So if you do smoke, try to stop smoking. If you have excessive alcohol intake, you want to reduce the amount of alcohol intake as well. And also, if you know that someone in your family had a history of breast cancer, you can go to your doctor and see if you can do genetic testing to see if you have that same gene that puts you at a risk for developing breast cancer as well. So yes, there are many things that we can do to help reduce our risk. No, it won't guarantee that you won't get it, but it can reduce your risk. You can watch your diet, you can exercise as well, that help reduces obesity as well, stop smoking, reduce alcohol intake, and follow up with your physician at least once a year.
Good afternoon, Dr. Mills. All right, earlier on in your presentation, you mentioned that men is also at risk for breast cancer. I want to find out, how do we go about finding out, how men go about to know if we are at risk or if we are diagnosed with breast cancer? Because I know females do their mammograms, but what do we do as men?
Same thing.
Same mammogram?
Yes, yes. Like I said, you want to do your monthly self-exam as well. So you feel your breast as well to see if you feel anything abnormal with regards to a lump, see any abnormal discharge. You can also, if you know that you have a close relative who have had breast cancer, you can also do the genetic testing as well. And you want to as well do your annual screens with a mammogram and follow up with your physician. They may recommend an ultrasound in your case, being that most men, they don't have as much breast tissue. So you can still follow up with your physician and they'll tell you whether they recommend a mammogram or an ultrasound with regards to detecting any abnormal lumps.
Good afternoon. Regarding the testing, you mentioned a while ago about the ultrasound and the mammogram. What is the difference in terms of what does the mammogram pick up that the ultrasound doesn't, or vice versa?
The main difference between the two is mammogram, it shows more detail, right? In the cases where they will recommend an ultrasound if you're under the age of 40, because under the age of 40, sometimes you have more breast tissue and it may be more difficult for the mammogram to maneuver and detect any abnormal lumps. They may recommend an ultrasound at that time. But the main difference is, one, mammogram, it uses radiation, ultrasound doesn't. And it's in more detail compared to an ultrasound. I wouldn't say they're necessarily more at risk. You should follow up to see what's causing you to have those lumps. Oh. Okay. But you should still do your annual exams every month just to ensure that it doesn't develop into something more malignant.
Are there any more questions? All right, so seeing that we have no more questions, we would like to just express thanks to Dr. Mills for sharing with us, for re-enlightening us on some of the things that we already knew and maybe kind of not really paying so much attention to. But we thank you for speaking with us, and we pray that the information that has been transferred, that we will act upon it if the need arises, and that God will continue to bless you in your work so that you can continue to bless others.
Okay, we have had a fruitful session, and as we leave, let us all share the knowledge and continue to encourage each other, both male and females. Praise the Lord. Thank you. Have a blessed afternoon. AIM members, remember we meet upstairs, and I think Sister Chablal also have 5 minutes with the ladies. So AIM members, let us go upstairs.